Thanks everyone for being here today. We're going to spend the next 40 to 45 minutes discussing something that we see across nearly every medtech company we work with. Teams doing a lot of marketing activity, but not always seeing the traction they expect. Today is about simplifying that and giving you a very focused and practical 90-day way forward. Before we get too far in, I just want to ground who this session is really for, because this only works if you see yourself in this situation. So, this was built for teams who are responsible for driving growth, not just activity. That's marketing leaders who are being asked to show results, founders and CEOs who know their product has value, but maybe adoption isn't moving as fast as they think it should, commercial and sales leaders who are having a lot of conversations, but not always seeing those translate into action, and product or launch teams who are trying to bring something new to market and realizing it might just be a little bit more complex than you expected. If you're in any of those roles, you're likely balancing a lot: expectations, pressure, competing priorities. So, this session is not about asking you to do more, it's about helping you to focus on what actually drives traction so the effort that you're already putting in starts to work harder for you. And who are we that are chatting with you today? Well, I'm joined by our founder, Lisa Bichsel. Lisa, thank you for being here.
Glad to be here, Lauren, and to continue to share insights from our personal and collective experiences.
Awesome. Lisa brings over 40 years of experience in medical sales, marketing, and commercial leadership. She's helped medtech companies of all sizes launch products, build market presence, and accelerate growth. Lisa also published a book last year called So You're Launching a Medical Device, which you'll receive for free if you book a discovery call with us after this webinar. It's also available for purchase via Amazon. And I'm Lauren Dustman. I'm CEO of BMMG, and I've spent over a decade helping medtech companies elevate their brand, drive sales, and break through in competitive markets. And what ties our experience together is this: helping teams move from strong ideas into real market traction, otherwise known as engineering adoption, which is what we like to call it at BMMG. And now, who is BMMG? Before we go further, just a quick word on who we are and why our perspective on market planning comes from real world experience. BMMG is an outsourced medical marketing department. We're not an agency that executes tasks, but a team that thinks and sits like it's inside your organization. The key difference is, again, we don't just execute marketing, we help teams decide what's actually worth doing in the first place. And our team has worked across a wide range of clinical areas. We understand how clinical priorities, commercial realities, and operational constraints collide in the real world. We've supported companies at very different stages, from early innovation all the way up to established market leaders. And the logos that you see here at the bottom of the screen are just a snapshot of our client base, but the common thread is this: these teams needed marketing that understood their buyers, respected the complexity of healthcare, and supported their sales in a meaningful way.
And Lauren, I just wanted to point out that the healthcare verticals shown here are yes, where we have a ton of experience, but there are some other care areas or service lines where we also have depth, such as dermatology, infection control, women's health. I just wanted to point out that our experience is broader than what reflected on the screen.
That's a good point. Thank you. Okay, so before we get into the meat and potatoes of today, we want to start here because if any of what I'm about to say feels familiar, you're definitely in the right place. You're doing a lot, but it's not always clear what's working. Sales is active, but deals aren't moving as easily as they should. Clinicians see the value in your product, but it's not rising to the top of their priorities. And maybe your targeting is broad because your offering could apply to many different stakeholders, but traction feels slower than what you expected. If even one of these resonates, that's exactly what we're here to address today. So, I wanted to get a quick pulse check. Do you struggle to block out all the possible opportunities and distractions and concentrate your precious resources on the right activities that will yield the most short-term gain? Answer yes or no. There are no wrong answers here. We just want to understand where you are and what pain points you're experiencing. We'll give it just a couple of seconds here. All right, let's go ahead and show the results of the poll, please. Okay, so looks like we have about a 70-30 split. Yes, we struggle to stay focused. No, we're really good. For those of you who are struggling, that is a-okay. Hopefully, we will be addressing things that really resonate with you and help you for the next 90 days to focus and to not struggle on understanding those right initiatives. And those of you who are really good at staying in the course, awesome. I think there's still a lot of great tidbits that you can get from today's webinar to just continue to laser your focus on what works and what will build traction.
Okay, so it was very difficult to select just one quote to show here. There are so many very respected figures emphasizing that doing fewer things well is far superior to doing few things. Trying to do too many things at once. So while Confucius is noted here and said that nearly 2,400 years ago, it does stand the test of time. Millennia later, that we have to focus on doing the fewer things when our resources are limited. We just have to concentrate on mastering those remaining activities. And the challenge isn't knowing this because it's so obvious, it's common sense. It's really applying this consistently when there are so many competing priorities and inputs.
Absolutely. Also, you'll see this slide appear several times throughout today's webinar. Think of this slide as our GPS. You always know where we are, what we've already passed, and what's coming up next. And speaking of next, over to you, Lisa.
So, this is the classic MedTech marketing trap. We mistake activity for signs of success, but we're often missing the point. This is the watch out. We see it a lot. Teams react instead of direct. And you may come to it honestly, meaning that a board member, an investor, and other key influencer keep throwing their ideas onto your commercial plate, adding tactics instead of really building momentum. And out of respect for that position or that individual, you may be forced to add yet another project onto an overwhelming pile of programs. So here's a tip. If you have a plan in place, these derailments can be diffused by saying respectfully, that's a great idea. We have a 90-day plan in place right now, and we're remaining surgically focused on executing that plan. I'm adding your insights onto our next round of planning. Thank you very much for your input.
That's a great point. So now let's make some of the symptoms a little bit more real. These are some of the other patterns that we see when traction isn't where it should be. And I guess at least one of these is going to sound familiar to you. So first, we have some inconsistent messaging. And that's not because your team isn't capable. It's because different people are saying vastly different things depending on the audience, the setting, or the moment they find themselves in. And over time, that inconsistency makes it harder for the market to understand where you actually fit. Now, granted, your product you're offering is going to have different value for different stakeholders, but at the end of the day, everything should translate to the same bottom line cross audience value proposition. So we really need to make sure that that's in place. Next, you have educated reps but confused customers. So your sales team knows the product, they've been trained, they can answer the questions. But if the customer still walks away, still unsure why your offering matters right now for them, then something is breaking down in how the value is being communicated.
And Lauren, if I may, that last point is an important one. It's really a good idea to have a litmus test for your materials and your messaging. Someone who can point out when you are into the techno babble of your technology at a level that the end user doesn't care about or actually need to know to make a decision. So again, reps can be absolute masters at knowing their product inside and out, but they need to be able to translate that to customer needs and their pain points and priorities.
Definitely. Next is that there's content that exists, but it's not moving the needle on deals. So I'm sure you have slides, one pagers, clinical data, but it could be that they're not being used in the moments that matter, or they're not framed in a way that actually helps a customer make a purchasing decision. And this last one is a big one, mistaking awareness for the end goal, which is a purchasing decision. Awareness feels like progress, but in MedTech, awareness alone doesn't change behavior. What we're really after here is earned attention, meaning somebody sees your product as relevant to their world. And ultimately, behavior changes where they actually do something differently because of your product. So when you step back and look at all of these symptoms, they may seem like separate issues, but they all point to that same root cause. And that is not a lack of effort, but it's a lack of clarity and focus on how everything is connected. Quick check-in on our roadmap here. So we've characterized the problem by identifying the symptoms that are associated with poor traction. Now let's explore how to avoid these pitfalls. It begins with a better understanding of where our product fits into the market. So let's assess your market fit.
All right, this step is critical and it kicks off the entire refocusing of your efforts. We recommend you and your leadership team sit down and agree upon these key questions that we're going to run through here in just a second. If there is doubt or disagreement, please validate it by collecting some voice of the customer or VOC to ensure what you think you know has actually been validated and is now what you absolutely know to be true. So, answers to questions like, where does your solution, your technology sit in the standard of care? Is it a replacement for it? Will it augment it? Would adoption of your offering mean today's standard of care, if avoided entirely, perhaps, or maybe just delayed in its use? What's the answer to that question? And another way to look at this is to really ask yourselves, if we disappeared tomorrow and our solution was gone from the market, no longer available, who would notice?
Exactly. And the next question your team should ask itself to gauge how well you truly understand your product and its fit is to identify what are the flaws with the current solution and what is broken today that your technology would resolve. And beyond that, not just what's broken, but for whom is the problem at its most heightened? Who suffers the most with the shortcomings of today's standard of care or approach? Think in terms of clinical friction, economic pain, workflow burden, and even sometimes emotional stress too.
And that's great, Lauren, because those insights captured by your leadership team then become, the next step is to honestly assess how important is solving the problem for your customer once you know those things. So is it a top priority, a burning platform, something where they're going to drop everything that they're doing and pay attention to you, your message, your product? And if not, what's competing for that attention in that visit, that day, that year, that budget? It's important to know that and assess it as well.
Exactly. And as Lisa was saying before, if your team can't agree on the answer, or if you even have the slightest doubt that your assessment is accurate, seek out the voice of customer. That is so important. And finally, have your team identify the tip of the spear. With your offering in mind, what is the most specific problem or user for whom this is a top priority and the urgency is right now, not in the future, but immediately? And now let's validate fit when we don't already know the answer. And this is the moment where teams can get stuck. They know that they should validate their assumptions, but they don't feel like they have enough data to do it confidently. And the reality is, you don't need perfect data. You just need enough signal to move forward with conviction. And this is how we recommend doing that quickly and practically. First is voice of customer. This is one of the highest ROI activities you can do. And all we're talking about here is 8 to 12 short, structured conversations, maybe 20 or 30 minutes each. You're not looking for long interviews. What you're looking for from this is patterns, and that's across clinicians, care team members, and at least one economic stakeholder. And that's because clinical value and economic value, they don't always align. And so you really truly need to understand both for your product and your offering.
Yeah, and Lauren, I think it's really worth pointing out that some of your best voice of the customer are not necessarily your tried and true friends and the family that are at the ready. Maybe they are already on contract and are investigators for your clinical studies, and those people are great, and that's easy to get to. Don't get me wrong, but you can't have groupthink. Okay, so you have to ask someone who's maybe been vocal about the standard of care being great. Someone maybe even working for clinical trials for a competitive device. Seek balance. In the end, and this is so true, if you have negative commentary but can overturn that naysayer ultimately, that's a bigger win for your technology adoption in the end, for sure.
Definitely. So next is the standard of care mapping. And we talked about that before, but what we're discussing now is about getting a very clear picture on what happens today. Let's zoom into standard of care. What is actually being done? Who is doing it? What are the devices? What are the products? What are the offerings? And at what cost do those come? Because if you can't clearly articulate the current state and the landscape, it becomes so difficult to position why change is needed and have your offering be raised up as the hero that everybody wants and needs. Next, we're going to look at common objections. And this is one that marketing and leadership teams often underestimate. Your sales team is out in the field hearing the truth every single day. Ride along, listen in, document it. What are the consistent pushbacks? Where do conversations and deals stall? Those objections, they're not barriers, they're signals to you. And they tell you exactly where your messaging or your positioning can be stronger.
And Lauren, again, I just wanted to say that if you're not otherwise observing it directly in that sales engagement with the customer, then give your reps a very safe environment, non-punitive, to respond without backlash and admit, not in maybe a big group setting, but in individual conversations, what is tripping them up? What obstacles are they encountering the most often? What obstacles might they be struggling to overcome with the customer? Again, don't make this punitive whatsoever, and allow them a safe haven for that kind of conversation to take place.
Exactly. Exactly. And finally, we're going to talk about priority stress testing. So this is where we learn how to separate interest from urgency. If the problem that you solve disappeared tomorrow, what actually changes? What gets more attention than your product you're offering today? And when does your solution matter the most? Because in healthcare, as we all know, everything competes for time, attention, and very precious budget. So if your offering isn't tied to a moment or a situation that truly matters, it's going to continue to get deprioritized in sales conversations. So when you put all of this together, what you're building is not perfect knowledge. You're building the confidence to act. And confidence does not need to come from knowing everything. It comes from knowing enough and having that validated so you can move forward decisively and start to create that traction over the next 90 days. Alrighty, we've assessed where we fit into the market and how much of a priority we are. Now we need to do a sort of content audit to be certain that our assets communicate where we fit into the market and that there aren't gaps in needed content and there are no redundancies either. So this will be an honest assessment. Let's put egos aside and come together to be as objective as possible here. So let's dig into that asset reality check because most teams assume that they have a content gap when in reality they have a content alignment problem. So the first thing that we would need to do is simply inventory what you actually have. And like we talked about before, there's clinical data, case studies, testimonials, tools, calculators. It's usually a lot more than you think. And the issue typically isn't the volume, it's whether those assets are being used in the right way at the right time with the right stakeholders. Then, after we do that assessment, we're going to look at what actually carries the message best. And this is where there can sometimes be a disconnect because evidence does not automatically equal persuasion. You can have great clinical data, but if it's not presented in a way that connects to the customer's priority, it will not move a deal forward. So different stages of the sales process require different types of assets. So early on in the process, someone needs to understand why they should care about your product or offering. Later on, they're going to need proof, validation, and then confidence to actually act and make a purchasing decision. If you're using the same asset for both parts of the sales conversation, you're going to lose the needed momentum. After that, we look at what's actually missing, and just as importantly, what's not needed. This is where teams kind of start to overcorrect, we've seen. They start building more and more and more content. But most of it falls into the category of nice to haves. Instead, we want to be really super disciplined here. What are one or two assets that will actually help move a deal forward right now? That's where the focus should be. And the shift here is pretty simple. We have to stop thinking about building an assets library, and we have to start thinking about building conversion tools, because content should not exist to check a box of what is in the marketing toolkit. It should exist to change a purchasing decision.
Oh, Lauren, something just came up. I know one of the things that we do regularly with clients is sort of a tool assessment and mapping, and to the identified pain points of customers. It's helpful, and I know this is something you do regularly, especially, is that you look at all the assets, you look at all the pain points, and then you say, for this pain point, use these tools. That kind of a simple mapping can really help whoever's facing the customer to understand what tool to grab off the shelf.
Yes, that is something that I know, an exercise that I've done before that was super helpful to create focus for the sales team is where are you at in the sales product process? Which stakeholder are you talking to? And now this is the asset to pull down off the shelf that actually moves the needle.
Mhm.
Okay, so now we move into one of the most important and yet sometimes most resisted steps.
So once we understand where we fit and what problem we're solving, the next question becomes who should care about that the most? And this is where many teams can also, again, lose traction. The instinct is to go broad so many times, multiple specialties, multiple settings. We must resist that temptation or we risk diffusing our momentum. So instead, we define a best fit customer profile, the group most likely to understand the problem, feel that urgency, and act upon it. That comes down to three things: their specialty, their site of care, and the stage of adoption. So because context does matter, you can look at it as a hospital, an ASC, and a private practice may all use your product, but they make decisions very differently for different reasons. And if your message doesn't reflect that, it's really easy to ignore. And we have this analogy that keeps coming to mind, which is, an email. We all send and receive a lot of emails. If you receive an email and you're not in the to, but you're in the CC, chances are you're scanning through it and you're thinking, okay, it wasn't directed to me. It doesn't call an action out of me. It's for my information. So you might either delete it entirely or put it away, put it aside, and not pay attention to it. So make sure your messaging is perceived as coming directly to the person you're targeting. Okay. So rather than trying to reach everyone, we focus on where we can win first, where the problem is most visible and the barriers are the lowest. And then that becomes your market foothold, because traction doesn't come from being everywhere. It comes from winning somewhere and then expanding from that proof point.
Exactly. And I want to stress from the proof point. No assumptions here. Let's expand based on what we know works. Okay, now we've done the hard thinking that a lot of teams unfortunately skip. And the question is, how do we activate them? So let's talk about what we're going to do over the next 90 days that will actually create traction here.
So yeah, this is actually really truly getting down to cracking the knuckles and getting busy on turning strategy into execution and where clarity can yield momentum. So the focus here is on, again, recognizing your value compared to the standard of care, your content that you have already or might need to develop, and certainly identifying your best fit or your most suited targets. And if you've got all those components together, now we can build your 90-day plan. So let's do so. It's not about we're going to keep being a broken record because it can be overwhelming in a smaller company, especially where you have limited staff. You don't have to do everything. It's about orchestrating a few channels and doing it extremely well with one consistent message. And while this framework may be crystal clear, what's shown here, I'm going to take it to the next level and we're going to step down a little further into the building blocks of the plan, as well as a summary, executive summary of your 90-day plan as an example that we have with a client. Okay, so um, there's a lot here, but this is the handout in essence. The little thumbnails you see in the upper corner are this multi-page document that you're going to get. And then you're going to step through it. You're going to answer the questions, fill in the blanks, give it some thought, and fill this out. And by the end of it, you will have your 90-day focus plan. There's going to be prompts for things like, where does your technology fit in with the standard of care? Who is complaining about the standard of care now and why? Is fixing the brokenness a priority for your customer? What is your most effective messaging? Your tip of the spear. What can you communicate with the very focused effort about being able to solve issues with your customer on today's care pathway as a comparison? And who is your best customer target? What are the most solid pieces of content that you have to leverage in targeting that customer with your tip of the spear message? What methods, channels, activities will you use to communicate that? What's your schedule, your cadence of those communications over this 90-day plan? And of course, what will success look like? Not just vanity metrics, not just clicks and likes and that sort of thing, but truly meaningful engagement metrics that matter the most to your organization and its growth. Okay. Phew, that is a lot, but it's really worthwhile when all that is documented and in one place. And then you pull it all together and you can summarize it with a statement. Let's give you an example of that. Okay, so again, what we've done here is an example of how that statement came together for a well-defined 90-day plan for a client of ours. So over the next 90 days, we will focus on driving adoption of our UVC disinfection system among OB/GYN clinicians in the hospital-based ultrasound department and those who are currently relying on chemical high-level disinfection processes that create workflow delays and consistency. You can see how all of the things we've been talking about come together and get answered and blended into this summary. We will position our solution as a faster, standardized alternative by emphasizing improved throughput and reduced variability using clinical data and KOL-led education delivered via vehicles, LinkedIn, and targeted HCP webinars. And for what output? To drive department level evaluations and pilot adoptions. So it all comes together here. And again, it's very defensible for you to say, here's what we're working on. Let's don't distract ourselves. Stay the course. This is what we're doing.
Exactly. So, what does success actually look like in a typical MedTech marketing program launch? Let's make this a little bit more tangible. So, clear signal versus noise. And when we talk about that, early on, most teams are hearing a little bit of everything. It's, oh, this product could be interesting for us, or maybe in a different setting, or, we need to look into this. And that's a lot of polite interest, but that is not movement. That is not a clear signal. When something starts to shift, you'll hear, this is exactly the issue that we're dealing with in our OR, lab, clinic right now. And it's coming from the same type of customer in the same setting tied to the same use case. That's when you know that you have found your clear signal. For better conversations, at the beginning of a launch, conversations often sound like a product overview. Reps are covering features, capabilities, everything that your product can do. But once things start to click, that conversation changes. It becomes, oh, here's where this fits into what you're doing today, Dr. Bichsel, and here's how it can improve outcomes, workflow, cost. And you'll notice that customers are going to start interrupting with questions. They'll start mapping your product to their own environment. They'll bring in additional stakeholders to conversations. That's a completely different level of engagement. And then thinking about sales enablement that actually enables, most medtech companies, they start with that full suite of materials. They have decks, brochures, clinical summaries. But very quickly, you'll notice that a few pieces of collateral rise to the top. For example, it could be a before and after workflow visual, a short clinical or operational use case video that mirrors the buyer's world, a one pager that answers the most common objections, whether that's cost, integration, risk associated. And you'll see your reps naturally gravitate towards those materials. And you'll hear from your team, oh, this is the piece that helps it all click when I'm having a sales conversation. Or once I show this tool, the conversation moves forward without friction. And when we see all of these come together, you'll start to see early and meaningful traction, more second and third meetings, shorter sales cycles than in the initial launch or segment. And then also early adopters who are willing to pilot or champion your product internally. It's not across the entire market yet, but in a very specific pocket where you're winning consistently. Let's talk about this quote. So, there's nothing so useless as doing efficiently that which should not be done at all. So, most teams, they don't struggle with effort or intelligence. They struggle with focus and also deciding what not to pursue. So, if any of this felt familiar today, it is not a capabilities issue, it's a clarity issue. And clarity is really hard to create internally sometimes because you're close to everything, the product, the vision, all of the possibilities. And that's why an outside perspective can help. VOC, talking outside of friends of the family. And it's not because those people know more, it's because they can see more clearly what actually matters and what actually resonates with your targets. And that's because at the end of the day, traction does not come from doing more. You all have enough on your plates as it is. Traction comes from doing the right things in a very focused way and doing them consistently. Okay, so before we move into Q&A, I'll keep this very simple. If you would be open to a quick discovery call on how to explore how we could apply this for your team and what a focused 90-day plan might look like, please just answer yes or no in the poll. If you say yes, our webinar admin will drop a link into the chat so you can book a time with Lisa and myself directly. No prep is required, no pressure, just a focused conversation to see if this is a fit for where you are. And if now's not the right time, that's completely fine. We definitely appreciate you spending the time with us today. This discovery call is not meant to be a pitch. It's simply a way to take what we discussed and make it real for your specific situation.
And Lauren, I might say there's just a little bit of prep work because if you did choose to book a call with us, I think we could really benefit if you came with one of the elements of the building blocks of this 90-day plan in mind as to where you're struggling the most, whether that's, addressing your content, determining what's the best fit customer, understanding where you fit in the priority and the pain points of your customer. If you could tell us where of the building blocks is your biggest struggle, that would help us then to make the most use of that time with you. A little bit of work.
A little bit of work, a little bit of prep, but worth it. All right, thank you. And we can probably go ahead and move on to our Q&A. So I did see several questions pop up during the webinar. If anybody has additional questions, now is the time to drop them into the Q&A. Please do use the Q&A instead of the chat because it'll just be easier to track for us. But one that I'm seeing here is this all makes sense. Thank you. But how do you actually narrow your focus without feeling like you're leaving business on the table? Lisa?
So that's probably the most common concern that we hear is the fact that it feels like I'm going to lose money, I'm going to lose traction, I'm going to lose a customer segment or something like that. No, the key is shifting and realizing that you're shifting to not eliminate an opportunity, just to sequence it, to prioritize it. You'll get to it, but maybe it's just not today. It's not this next 90 days. It's down the road a little bit. So in early commercialization, trying to go broadly usually slows everything down. Messaging can get diluted. Sales conversations can vary, all the things we've talked about as far as the watch outs throughout this webinar, and you don't build momentum anywhere. When you can narrow down to a best fit segment, you actually can learn faster things that are critical, like what really resonates, what objections come up that you can overcome and, get to the next level of your sales cycle, and what proof points matter to your target market. And once you have that, expansion becomes much easier and much more credible. It's not about thinking smaller or eliminating anything. It's about winning in a focused way first, so you can then scale with confidence.
Thank you, Lisa. That's a great answer. I just saw another question come in. It says, you're right. Practitioners do have a number of competing priorities. How do you get through in the first place? Cold email, trade shows, cold calls, Facebook ads, question mark, question mark. So, if you want to, I think we both have perspectives on that. If you want to share yours first, and then I can add to that.
Sure. Again, this is one of those things where you can guess all day long, but because your audience that you're trying to reach are so busy, you need to take a step back and go, what is keeping them busy? What will break through that noise, their busyness? If they have 10 things going on right now, what will I say or do that will have my message jump to the top? So it's less about the vehicle that you use and more about, are you thinking in terms of their pain point backward? How does the three or four things that are keeping them up at night trickle back down, and where your product fits in to solve one of those issues, to help them with one of those things that are giving them a lot of heartburn and cause for concern? If you can work that through and understand how you fit into one of those big picture issues, then I think you're going to find that whether it's an email, a call, a trade show graphic, whatever, the vehicle matters less than just simply understanding that message.
That's great. And something else I want to add to, and Lisa and I have had a separate webinar about this, but it's about peer-to-peer selling and messaging, because medical professionals, practitioners, they are going to want to hear from their peers rather than an industry counterpart. So, what we have done and encourage clients to do is to have a webinar that's led by an HCP that focuses on the HCP's perspective, their reality, their pain points, and then how your technology helps solve that. Another place that we actually just had great success is we hosted a CE dinner program in a region where we're having a really hard time gaining that foothold and traction. And because we had a nurse practitioner present to all kinds of different healthcare professionals, and we had that carrot to dangle with a CE credit, we got a lot of traction and were able to penetrate into accounts that weren't giving us the time of day before. So I think that leveraging a KOL or a HCP is a really great way to kind of break through that barrier that a lot of HCPs have when it comes to industry trying to break through.
Lauren, I'm so glad you pointed that out, because I'll wipe out everything else I said. Because the vehicle does matter when it's peer to peer. Whatever you can do that's peer to peer, that is your brass ring, honestly. Yeah.
True that. Okay, so we have another question, is that the presentation focuses on our offer, but how should we relate to the competitive environment, and if at all?
So that's a sort of like, it'll depend. I would say that I don't try and fold in a bad analogy, old analogy, but I'm gonna use it anyway. It's the McDonald's versus Burger King approach. We're all consumers. We all probably seen ads. McDonald's never beats up the competition. Burger King always beats up the competition. Which one's winning? McDonald's, right? So pull in a competitive, negative factor of their technology, if you have to, of course, but think about it, just being nothing but positive about what you do, how you help the pain point, which is neutral and really product agnostic, right? Try and leverage that first. So that's one part of the question. What was the other part, if you wouldn't mind reading it again?
I think that's it.
Okay.
Focuses on your offer. How should we relate to the competitive environment? And yeah, as Lisa said, it depends. I think if you're already if you're trying to enter into a market that's very crowded, it's not bad to be able to have a scorecard almost like a game sheet. If you can show yourself versus other competing technologies and where you win, you can do that. You can show the shortcomings of the standard and against competitors. We don't need to necessarily have them named, but we can show that we're better and we can get into a little bit of specifics, but we just have to do it in a way that's very tactful, that's FDA and FTC compliant. But there are different things that we could do to elevate you above your competitors, or you could do
Yeah.
it yourself.
And again, if it worked out to where you rose your hand or clicked that said, I would like to meet, that would be a fun one for us to dive in together personally and specifically about your situation.
Absolutely. Um, all right, I have another question here, and that's what if we don't feel like we have enough data or content to support that 90-day push? Uh, uh, Again, that's a real situation, but as we shared during the webinar, a lot of companies, they already have more content than they think. It might not be branded beautifully, it might not be a lovely brochure, but typically the issue isn't that lack of content, it's the alignment. So ask yourself honestly, what do we already have that answers real customer questions? And what does sales actually use when they're having a tough conversation? From there, we would identify some gaps, maybe one or two, not 10, and we would fill those quickly. And that's the goal of the 90-day program. It's not to build that huge content library, it's to activate the right content in a coordinated way so it actually drives behavior. And maybe you don't have any marketing documents or sell sheets right now, but certainly there's got to be some level of data. There has to be real, just conversations that have been had with your targets where we can gain insights. And we could easily look at what is it, what are two vital tools that we could create based on the information that we have.
And Lauren, on that, I always like to say, because a lot of companies we talk to, right, are very much upstream. They're not yet into that commercial phase, and they might have, really do struggle with having clinical data to speak of.
That's right.
We always say, don't be embarrassed about what you don't have. Be proud of what you do have, even if it's bench tests, it's single site case study, it's a poster that was a single patient focus. Whatever it is, leverage it. The more you can build, the better that content ultimately will come. And it's just this growing body of evidence. It's not meant to be static, it's evolving. And it's okay to be at the start of that.
Yep, agreed. Totally agree with that. All right, so how do you know if a problem is truly a priority for clinicians versus just something that they all agree is kind of cool and interesting?
Well, I'll take that one.
Okay.
So it's an important distinction, and where a lot of strategies can get off track. Interest is easy to get, somewhat. Priority is a much harder thing to acquire. So the way we test that is by listening for trade-offs. In other words, when you ask things like, what happens if we don't get this solved? What gets more attention than this right now? You start to understand where what you're talking about sits in their world. Is it a true priority? And if so, you're going to hear it sort of ultimately get categorized in one of these main buckets, which are things like it's an operational impact that it's having right now. My focus is on things that take away from patient time and our pressures for room turnover and things like that. It's a time pressure. It's risk that we have with our existing approach. It's that need to improve outcomes and measures and quality measures. It might be an economic issue and the consequences of that. So if you don't hear those things ultimately when you're listening critically, it's probably that what you're talking about is not urgent enough. And so that means that how you position your technology might need to be massaged and refocused.
And that's where that VOC comes into place too.
Mhm.
And I know that we had talked about short conversations with healthcare providers and professionals, but this can also be done in something as simple as a survey that goes out and is targeted through SurveyMonkey to pressure test, do people actually care about the problem that you're solving and who cares about it? And you can get great data for something that's not a huge lift and a huge financial burden for your team. Another question here is okay, what does success actually look like after 90 days with this plan? So as we touched on, the goal of the 90-day program isn't volume, it's momentum. So I think that, from our perspective, you want those more consistent, higher quality conversations. You want very clear feedback on where messaging is landing, increased engagement from the right audience, not just more clicks, and ideally those early signs of adoption or advocacy within the segment that you're focusing on. Um, when you're creating your 90-day plan, go ahead and just think about what are your commercial goals? What is your sales team trying to accomplish over the next 90 days? Where are you currently? And then try to map, look at what you're trying to get to and map to that after 90 days. This is something where you get through those 90 days, you observe what's happening, you get live feedback, and then after that, you can pull up, assess, and course correct if needed. But it's important that you have buy-in from the team and you have those set goals that you're trying to accomplish, and that we're all aligned, rowing the boat in the same direction as to where we're trying to go deep and not wide. So really, success is not, oh, we're doing a lot of things, we're trying a lot of things. Success will be we know what's working and now we can build from here. It creates that much stronger foundation for the next phase after that initial 90 days.
And Lauren, I think you hit on something that was really important. I just wanted to stress is that we all want to have data. Data is king and wonderful, but think about both a quantitative and a qualitative assessment of your success. Because, like she said, when Lauren was talking about talking to the sales team and hearing back about how things are improving, you want to a success can also be just morale, right? It's that a rep can say, hey, I can't show you the numbers just yet, but I can tell you that it's changing the nature of the game. I'm more excited to talk about it. I feel better equipped to talk about, a bigger, stronger, deeper relationship with my customer. And time will tell how that then turns into sales and data.
Agreed. All right, I'm going to do one final call for questions. And if no more come through, we will go ahead and move on to the last segment of our webinar, which is talking about the additional resources that you all will receive. But thank you for your engagement during our Q&A. All right, I'm going to move my Q&A box over here. If any more pop in, then I'll circle back. And if not, then we're going to talk about actionable additional resources. So, along with the recording and the slides from today, we'll also be sharing these three, actually, now four. We have a little surprise for you all, but first is that 90-day traction blueprint that Lisa was talking about during the webinar. And that's a simple structured framework that walks you through building your own 90-day plan. It takes what we covered today and turns it into a very easy fill in the blank format so you can move from ideas to execution very quickly. Second is Lisa Bichsel's book, So You're Launching a Medical Device. Chapter 2 specifically dives deeper into market planning and content strategy. And as a reminder, you will get a book at no cost, a digital copy at no cost if you book a discovery call with us. Third, we have the MedTech Traction Diagnostic Tool. This is a quick 5-minute self-assessment that you can complete with your team to evaluate where you stand today. It also will help you identify where you have the biggest opportunities to improve. And Lisa, do you want to talk about the final tool here?
Yes. So I've added yet another juicy resource, which is a list of the top 100 types of content by user or use and the stakeholder that it appeals to. And so please hear me loud and clear. This is by no means to be a checklist of all the things that you have to develop. No, no, no. It is a way for you to browse through the list by category, by customer facing content, and recognize what you may already have in your own inventory that's been completed and is ready to put into play.
Excellent. So, whether you're ready to build a plan or just pressure test your thinking, or maybe even just get a clearer picture of where you sit today, these resources are designed to help you take that next step in your planning process. And that, my friends, brings us to the end. So thank you again for your time today. And if there's one takeaway that I'd like to leave you with, that we'd like to leave you with, is that traction does not come from doing more. It comes from doing the right things in a very focused way consistently.
Yes, thanks for spending time with us today. We hope you found value in what we did share, and we look forward to continuing the discussion with you on an individual basis. Thank you.
Excellent. Thank you.